Sepsis. Understanding its long-term impact and the critical need for early detection. Introduction. Sepsis is a life-threatening condition that arises when the body's response to infection causes injury to its own tissues and organs. Despite advancements in medical care, sepsis remains a significant global health concern due to its high mortality rates and complex management requirements. Recent research underscores the importance of early detection and comprehensive post-sepsis care to improve patient outcomes. Sepsis, definition and pathophysiology. Sepsis occurs when the body's immune system overreacts to an infection, leading to widespread inflammation, tissue damage, and potential organ failure. This dysregulated immune response can result from bacterial, viral, or fungal infections. If not promptly treated, sepsis can progress to septic shock, characterized by a significant drop in blood pressure and multiple organ dysfunction, often leading to death. The global burden of sepsis. Sepsis is a leading cause of mortality worldwide. In the United States alone, over 1.7 million adults develop sepsis annually, with approximately 270,000 fatalities. Notably, 1 in 3 patients who die in a hospital had sepsis during their hospitalization. These statistics highlight the critical need for improved sepsis recognition and management strategies. Long-term outcomes following sepsis. While immediate treatment is vital, recent studies have shed light on the prolonged impact of sepsis on survivors. A Danish study conducted by Aarhus University Hospital examined 714 patients admitted with sepsis and found that over a median follow-up period of 2 years, 50.6% of these patients died from any cause. This finding underscores the enduring vulnerability of sepsis survivors and the necessity for ongoing medical attention post-discharge. Identified risk factors influencing mortality. The Danish study identified several factors that significantly increase the risk of death among sepsis patients. Advanced age, each additional year of age was associated with a 4% increase in mortality risk. Cancer history. Patients with a history of cancer faced a 121% higher risk of death. Ischemic heart disease. This condition elevated the mortality risk by 39%. Dementia. Individuals with dementia had a 90% increased risk of death. Recent sepsis hospitalization. A previous sepsis admission within the last 6 months raised the risk by 48%. These findings highlight the importance of personalized care plans and vigilant monitoring for patients with these risk factors. Challenges in sepsis diagnosis and management. Diagnosing sepsis is particularly challenging due to its nonspecific symptoms, which can mimic other conditions like the flu. Common indicators include fever, rapid heart rate, confusion, and difficulty breathing. The subtlety and variability of these symptoms necessitate heightened awareness among healthcare providers to ensure timely and accurate diagnosis. Early intervention is paramount. Studies indicate that for every hour treatment is delayed, the risk of death increases by 4% to 9%. This statistic emphasizes the critical need for prompt medical evaluation and initiation of treatment protocols when sepsis is suspected. Strategies for early detection and prevention. To enhance early detection and reduce sepsis-related mortality, several strategies can be implemented. Public and professional education, raising awareness about sepsis symptoms among both the public and healthcare professionals, can lead to quicker recognition and response. Standardized screening protocols. Implementing routine screening for sepsis in hospitals, especially for high-risk patients, can facilitate early identification. Vaccinations and infection control. Preventing infections through vaccinations and stringent infection control practices can reduce the incidence of sepsis. Antimicrobial stewardship. Judicious use of antibiotics can help prevent the development of resistant infections that may lead to sepsis. Post-sepsis care and monitoring. Given the high mortality rate within 2 years post-sepsis, comprehensive follow-up care is essential. This includes regular medical evaluations to monitor for potential complications, mental health support to address issues like post-traumatic stress disorder, and rehabilitation services to aid in physical recovery. Healthcare systems should prioritize the development of post-sepsis care programs that address the multifaceted needs of survivors, aiming to improve long-term outcomes and quality of life. Conclusion: sepsis remains a formidable challenge in healthcare, with significant immediate and long-term impacts on patient survival. The insights from recent research underscore the necessity for early detection, prompt treatment, and sustained post-discharge care. By focusing on these areas, healthcare providers can enhance patient outcomes and reduce the substantial burden of sepsis on individuals and healthcare systems worldwide.